Hi, my name is Dr. Anita Radhakrishnan, and I'm going to take you through the lifestyle changes that you can do to prevent high blood pressure.
Dr. Anita Radhakrishnan is the Director of Diversity, Equity, and Inclusivity for the Cardiovascular Institute at AHN. In this video, we are going to discuss the lifestyle changes to control high blood pressure. We will discuss salt intake, weight management, physical activity, alcohol consumption, tobacco cessation, stress management, regular health checkups, and finally, medications that can cause high blood pressure.
First, I'm going to talk about reducing your salt intake. Remember that salt is otherwise known as sodium, and that's what it's called as on our food labels. Salt causes retention of water, and when water is retained in our body, the blood volume increases. When the blood volume increases in your arteries, that causes an elevation in blood pressure.
Most people think low salt means avoiding the salt shaker. However, almost all the sodium or salt you eat is already in the food you buy at the grocery store or at restaurants. The most important thing you can do to lower your salt intake is to choose unprocessed or minimally processed foods. Processed foods are those that have been changed from their original form in some way. This can include food that was canned, cooked, mixed, or packaged. They often also have added preservatives, flavors, salts, sugars, or fats. It is recommended to buy fresh or frozen fruits, vegetables, whole grains, low-fat dairy, lean proteins such as fish, turkey, and chicken, and plant-based proteins such as lentils, beans, green vegetables, and seeds. It is best to avoid red meats which have a high salt content.
If you're somebody who does not have high blood pressure and you want to reduce your chances of developing high blood pressure, we recommend that you stick to less than 2,300 milligrams of sodium in your full day of diet. That is equivalent to 1 teaspoon of salt. If you're somebody who has high blood pressure and you want to help reduce your blood pressure readings, we recommend that you stick to less than 1,500 milligrams of sodium. That is equivalent to about 2/3 of a teaspoon of salt in your day. Once you've reached your ideal weight, it's important to maintain that weight in order to control your blood pressure. Remember that when you've gained weight, you need to have more blood volume to be able to supply blood to all of your organs. And so that increase in blood volume causes high blood pressure. When it comes to weight loss, we recommend that you pick a plan that it works for you and be consistent with it. We also recommend that you check your weight on a regular basis. Next, we're going to talk about physical activity. We recommend you do 30 minutes of physical activity at least 5 times a week. This activity should be moderate level intensity. When we say moderate level intensity, it's activity that causes you to break a sweat. You could probably talk through it, but you couldn't sing your favorite song.
For some, this can be a tall task and difficult to complete because of physical limitations, work, and other practical daily life tasks. But exercise includes any movement and doesn't only mean a gym workout. Examples of exercise that are often enjoyable include walking, running, gardening, biking, dancing, and swimming. We recommend that for these activities you increase the intensity, frequency, or time you put into it, so you keep your body challenged.
So next will be about alcohol consumption. Our overall recommendation is that you don't drink alcohol if you don't. But if you do, it's important you do it in moderation.
For men, this means no more than 2 drinks per day, and for women no more than 1 drink per day. A standard drink is 1 12-ounce can or bottle of beer, a 5-ounce glass of wine, or a 1.5-ounce shot of hard alcohol.
Our next topic is tobacco use. We recommend to quit smoking and to overall avoid all forms of tobacco and nicotine use. It's important that you know that the chemicals inside tobacco actually causes thickening and damage to the linings of the arteries that run throughout our body, and that is why we develop high blood pressure. So if you smoke, you need to quit. Speak to your doctor about the multiple different ways that you can stop smoking. Next is stress management. Remember that stress is a common cause of chronic elevated high blood pressure. It's important to remember to practice relaxation techniques. These techniques could include deep breathing, yoga, meditation, prayer, or even just sleep. Sleep deprivation is a very common cause of high blood pressure. Any form of exercise and even movement is a quick and easy and effective way of reducing stress and blood pressure in our body. So remember to go to your health checkups. Remember to monitor your blood pressure at least once a day for at least 2 weeks before your doctor's visits, and take your blood pressure readings with you when you go to see your healthcare provider, and follow their instructions in terms of how to best manage it. Please make sure that medical conditions like obstructive sleep apnea and thyroid disease are well managed, because they're known to cause high blood pressure. And lastly, I want to talk about some of the medications that can cause high blood pressure.
Some medications that you buy over the counter without a prescription for colds or pain relief can raise your blood pressure. Decongestants that used to treat common cold can contain agents like pseudoephedrine, ephedrine, and phenylnephrine that can narrow blood vessels and elevate blood pressure. Non-steroidal anti-inflammatory drugs such as naproxen and ibuprofen, which are used to treat mild to moderate pain. Some antacids that are high in salt. Natural health products. And weight loss medications. You can always check with a pharmacist to see if they will affect your blood pressure before purchasing these medicines. Prescription medications that can also elevate blood pressure include birth control pills, postmenopausal hormone therapy, steroids, chemotherapeutic agents, and antidepressants. For those of you that experience high blood pressure readings in the office and normal blood pressure readings at home, you may have a condition called white coat hypertension. It is felt that the elevation in blood pressure in the office is due to the anxiety of being around healthcare providers. It is best to bring in blood pressure readings from home, as well as your blood pressure monitor, to the clinic to confirm your readings. Talk to your doctor about the risks of white coat hypertension.
We know that lifestyle choices can take a long time to show results, but don't get discouraged. Take small steps. Do it one at a time. And over time, you will notice a big difference. Make sure you use your doctor's office visits to ask your healthcare provider the necessary questions that you have about high blood pressure. Thank you.